Thank you, Mr. Speaker. And today I will be splitting my time with the member from Abitibi-Temiskaming. So, Mr. Speaker, as the seniors critic for the NDP, I'm sadly too familiar with the cost barriers of medications in our country for the most vulnerable of us. I'm pleased that the House of Commons is taking the time to discuss the implementation of a universal Pharmacare program. Without the hard work and dedication of our health critic, the member of Vancouver Kingsway, I'm not sure we'd be in this position today to address it in such a credible fashion. I've consulted with seniors across my riding and heard from many across Canada. I hear too many disheartening stories. Too many of them are focused on the high costs of prescription drugs. Mr. Speaker, too many senior Canadians are sharing the realities that they are facing with increasing poverty. Affording the essential medication they need as they age is a barrier that is only increasing. I've heard from seniors who are taking their medication every second day to make it last, from healthcare professionals who are desperately working to find the most affordable medication because too many of their patients are not able to afford the costs and therefore not taking what they need to support their health. Sadly, Canada is the only country with a universal healthcare system that does not have universal coverage of prescription drugs. I think it's time to change that. Seniors 65 and older are the heaviest users of prescription drugs in this country. The majority of seniors are using multiple drugs. In fact, 62% of seniors on public drug programs are using 5 or more drug classes. This gets very expensive, very fast. There's a reason I believe we need universal Pharmacare program. The statistics paint a crying need for the federal leadership. Here are a few examples. British Columbia shows the highest levels of barriers to access to medication problems at 29%. 1 in 5 Canadians report that either they or a family member neglects to fill prescriptions due to cost. In fact, Mr. Speaker, we heard evidence of this reality at HUMA Committee, where we're studying a national senior strategy this week from Ms. Wanda Morris at CARP, who confirmed this very clearly. Canada currently has the second highest rate of skipped prescriptions due to cost among comparable countries. This ends up costing our healthcare system much more in the long run as untreated conditions get worse, resulting in preventable hospital stays and doctor visits. The Canadian Centre for Policy Alternatives estimates that between 5.4 and 6.5% of hospital admissions are the result of non-adherence, resulting in costs as high as $1.63 billion. Mr. Speaker, in a country like Canada, this is a horrifying statistic. Spending is also increasing. Public drug spending on seniors increased from $603 million in 2002 to $1 billion in 2008. By 2036, the number of seniors will double. How many more billions are we going to spend before we actually take action and do something? In September 2016, the House of Commons Standing Committee on Health asked the Parliamentary Budget Officer, the PBO, to provide a cost estimate of implementing a national Pharmacare program. The committee provided the program's framework, including the inclusive list of drugs to be covered by Pharmacare. The PBO costing found out that in 2015-2016, Canadians spent $28.5 billion on pharmaceuticals. Of this, $24.6 billion would have been eligible for coverage under a national Pharmacare plan. Accounting for pricing and consumption changes, the PBO estimates that Canada would have only spent $20.4 billion in 2015-16 under a national Pharmacare program. The reality is, Mr. Speaker, this place would have saved $4.2 billion in 2016 if action was actually taken. The PBO is not the only credible source to suggest a universal Pharmacare program is sound economic policy. In 2015, there was a report authored by Canada's leading health policy experts published Pharmacare 2020, The Future of Drug Coverage in Canada. This study estimates that universal pharmacare would result in public and private savings of between $4 and $11 billion per year under reasonable assumptions. Pharmacare would yield significant savings for Canadians, principally because of the increased spending power that it would bring. During price negotiations, drug companies often inflate the price of their drugs and provide confidential rebates based on the bargaining power of each purchaser. Universality would further increase Canada's bargaining power by extending coverage to every single Canadian. Mr. Speaker, I think all Canadians understand the real reason that we need to be having this conversation. The most common drug class used by seniors is to lower cholesterol levels. Is it normal that a year's supply of a widely used cholesterol drug costs about $143 in Canada, but only $27 in the United Kingdom and Sweden, and under $15 in New Zealand? Canadians pay among the highest prescription drug costs in the industrialized world, second only to the United States. The administration costs for for-profit private plans are also enormous, around 15%, while administration costs for public plans are less than 2%. This is just good fiscal policy. So replacing private plans by a universal public plan would not only reduce wasteful spending, it would save Canadians an additional $1.3 billion a year in administrative costs. An overwhelming majority of Canadians, 91% in fact, Mr. Speaker, expressed support for the concept of a national pharmacare program that would provide universal access to prescription drugs. Mr. Speaker, that's not a surprise when millions of Canadians can't access the essential medication they need when they need it, and that is simply not right. Tommy Douglas, the father of Medicare, never intended to create such an odd gap in Canadian healthcare coverage. Prescription drugs and other services were always meant to be integrated into a system of comprehensive public coverage, along with hospital and physician services. So today I stand before this House, as New Democrats have for over half a century, to proudly proclaim our belief that healthcare in Canada must be a right and not a privilege. With the recent release of the PBO's report, it's clearer than ever that a national pharmacare program is not only good for the health of all Canadians, but also sound economic policy for all Canadians, especially our seniors. Our motion today calls on the government to commence negotiations with the provinces no later than October the 1st, 2018, in order to implement a universal pharmacare program. With a little political will, Mr. Speaker, we can finally make this happen for all Canadians. Thank you.
Questions and comments? Question commentaire? The Honourable Parliamentary Secretary to the Government House Leader.
Yes, thank you. Mr. Speaker, you know, it's actually been a fairly effective department over the last year and a half. When I was sitting in opposition, we objected to the fact that the Stephen Harper government chose not to renew the healthcare accord. And what we've seen is a very proactive government in terms of just trying to deal and deliver on the important issue of healthcare. And we actually achieved a new healthcare accord. My province was actually the last province and territory that actually signed on to that particular agreement. We have seen a national government, through the Ministry of Health, assist in providing that pan-Canadian agreement working on pharmaceuticals. We've now been in government for almost 2 years. It's getting close to 2 years. The NDP are trying to give the impression that this pharmacare plan could be virtually put in immediately. And my question to the member is twofold. Does she believe that there's a responsibility to negotiate and have discussions with provinces? And what percentage of the financing of a Pharmacare program do the NDP advocate that Ottawa should be footing the bill for? Are they suggesting it should be 20%, 50%, 100%? Have they even thought through their own policy on this idea? It wasn't Tommy Douglas that brought in the National Health Care Program. That was a Liberal government, Mr. Speaker.
The honourable member for North Island, Powell River.
Thank you, Mr. Speaker. And my only response to the honourable member would be that I encourage him to actually read the motion that's before him.
Questions and comments? Question commentaire. The honourable member for South Okanagan, West Kootenay.
Well, thank you, Mr. Speaker. I just wanted to ask through you, my friend from North Island. We've heard a lot of comments today, especially from the Conservative side, about increased taxes and the increased costs that government policy is putting on Canadians and businesses especially. And yet, one of the biggest payroll taxes, something that the Conservatives are always going on about, one of the biggest sources of payroll taxes is the cost of extended health care benefits. And I just wanted to ask the member if she could expand on that situation.
Member for North Island, Powell River.
Thank you, Mr. Speaker, and I want to thank the member for this very important question. You know, the reality is this motion is asking this government to take leadership and actually have a conversation with the provinces and territories so that they can create something much more meaningful. We have on paper information, results that tell us that this will save significant amounts of money. And in fact, isn't it the job of governments to come together where we can make things better for all people, rising up the opportunities for all people, and make sure that there's equal access? In my speech, I talked about the fact that health care and pharmacare should be a right of every Canadian, not a privilege. And we are still in a system that it has accessibility for some and accessibility highly barriered for others. And this motion and this action, if the government is willing to take forward something that their own the PBO has already told them will save significant amounts of money, it would make such a profound change in this country, and it's certainly time for that.
Bravo.
Questions and comments. The honourable member for Vancouver, Kingsway.
Thank you. I'd like to congratulate my honourable colleague for a brilliant speech, and it's well reasoned. You know, in this House, it's quite clear that the Liberals haven't read the PBO report or the motion, and it's clear that the Conservatives haven't read the PBO report or simply are blinded to the findings there. I'd like to ask my honourable colleague about ordinary Canadians who I think are far ahead of the government on this. About 69% of Canadians disagreed with the statement that overall the current system is working well enough and doesn't need to be changed. And 91% of Canadians support the concept of a national pharmacare program that would provide universal access to prescription drugs. So my question to my honourable colleague is this, what does she think Canadians' response will be to the Liberal government voting against a motion calling on them to simply start a discussion with the provinces within a year to begin the process of implementing universal pharmacare, which 9 out of 10 Canadians want?
The honourable member for North Island, Powell River.
Thank you, Mr. Speaker, and I want to thank the honourable member for this important question and also for the hard work that he has done on this file, fighting for Canadians and accessibility to health care and pharmacare. I think the results are in. Like he said, 91% of Canadians think that this is an important next step for our country. I know that in my riding, I've had conversations with constituents who have chosen to live in a van because of health care issues and they can't afford rent and their medication. These are the decisions that Canadians are making. So when I have to talk to elderly people in my riding who, as soon as January hits and they have to get to that, spend that amount of money before they start getting the subsidy and the support, who are saying, don't worry, Rachel, you know, I'll just eat a little less this month and I'll wear more sweaters because I can't keep the heat on. I mean, this is not a joke. This is seriously happening in communities across Canada. So I think the action needs to be taken. I think that Canadians are going to be extremely disappointed if this government does not support this motion.
On a prise de